Trends revealed by the South African National Council on Alcohol and Drug Dependence have revealed an alarming trend in South Africa. According to this research, 1 in 4 teenagers who are addicted to alcohol have been exposed by their families. Let's unpack this research a bit further and get you some insight on it. We're joined by Professor Marelize Schoeman, who is with Unisa's Department of Criminology and Social Science, and Adrie Vermeulen is the National Coordinator at the SA National Council on Alcoholism and Drug Dependence. To both of our guests, thanks very much indeed for coming on. And Adrie, as someone who is I imagine you would have been part of this research, tell us what else you found.
I think the shocking part for us is what kids are using, and Prof. Schoeman will tell you about that in a little while. But alcohol is still number one. Then we have cannabis. Vaping is a serious concern, and then lean, which is a mixture of cough mixture and no normal cool drink. That also scored very high in that prevalence study that we started doing, as well as looking at the age groups of when people are actually starting to experiment, or when our kids are starting to experiment. So we're starting to see tobacco and vaping at around 10 years of age. We're starting to see alcohol peak at 13 years of age, which really makes us concerned, because that means we need to focus our efforts on our young children already and start building on prevention programs that works for that age group.
Sure. I'm going to come back to you, Adrie, to talk about tobacco and vaping at the age of 10 and alcohol from the age of 13. But Professor Schoeman, I want to bring you into the conversation, because part of what the research has found is that alcohol dependence starts early in South Africa, and family members are often the ones to open the door to their children or to younger family members. What do you make of what the research says, and then what the perspective that, for example, I might want to have quite an open policy on alcohol, and if you are going to try it, you might as well try it at home first. How do we balance those two arguments?
Thank you, Michelle. Yes, that's very concerning. So the study that we conducted basically included 484 children. So that is by no means a representative study from a perspective of South Africa. But we are embarking on a new study in 2025 where we will do a nationally representative study. So basically, the primary findings that we got is that about 55% of the 484 children acknowledged using alcohol, with 10% indicating that they will use alcohol as young as or until the point of intoxication, and another 10% will use alcohol alone, which is a great concern within the context of addiction. Mm-hmm. So as we indicated that the youngest age that we picked up was about 8 years old, where children acknowledged starting to experiment with alcohol, but I think it's a lot younger. Peaking, interestingly, at the age of 13 and 16, which associated with some developmental areas in the child. But regarding the use of substances within social context, interesting, we found that drinking alcohol often was associated with drinking with family members and at family events, but that was not necessarily linked with excessive drinking. Drinking with friends, which happened less frequently, was more strongly associated with excessive drinking. And then parties was also not as strongly linked with frequency of drinking, but again with excessive drinking. And then a big culprit was found to be shebeens and taverns, which played a major role regarding heavy drinking. So a comparative analysis basically says that family interaction or family are the social settings where children are most frequently exposed to alcohol. But while drinking less frequent with friends, that is our problem areas, because that's linked with excessive drinking. And then, as we stated, shebeens and parties also being associated with both, more specifically with excessive drinking.
Adrie, I can't imagine just how widespread taverns and shebeens are in some of our communities, that this helps this kind of challenge and this kind of finding.
Yes, and that is the unfortunate part, is, Michelle, if we look at the access to these taverns, they are very much in a very close proximity of where people stay, and you also have obviously the illegal and the licensed one. So you have both of those situations, and we don't see that the laws are being enforced as well. Unfortunately, where we are making sure that these news shebeens are 500 meters or in a 50 specific radius from a school, from where a park is situated, and so forth. We see that these laws are violated all the time, and it's not being enforced by law enforcement, or from our point of view, also from the liquor boards that is supposed to also look at inspecting these licensed outlets and closing down the illegal ones.
Yeah, absolutely. Professor Schoeman, I sort of asked you this question just a bit earlier, but parents will often take the stance, particularly with their teenage children, to say that, it's better that you have a drink at home rather than doing it behind my back. What do you make of that kind of approach to this?
That's a very dangerous approach, because basically what the parents do is that they acknowledge that alcohol or the consumption of alcohol is acceptable practice. And I mean, it's not an acceptable practice for children. Mm-hmm. So it's a very, very, a very, very detrimental stance, because you are acknowledging alcohol as being socially acceptable, or underage drinking as being socially acceptable.
Right. Yeah, absolutely. And then, Adrie, please,
sorry.
Go ahead.
I wanted to add to what Prof. Schoeman was saying. Remember that we have a developing brain that's very sensitive. And if we introduce substances to this chemistry in the brain at a very early age, you're making that child very vulnerable to future use of alcohol and drugs. Right. So you actually putting the child at a disadvantage by starting at a young age to expose.
That makes absolute sense, particularly the issue around the brain still developing. I mean, if you're talking about an 8-year-old child that's experiencing alcohol for the first time, those kinds of settings, Adrie, where, family members might do it as a joke. They might let the child taste this or that as a joke at a family gathering. Is that something that opens the door for that child?
Definitely it does. It makes it acceptable, and the norms are changing as well. I don't know if you've seen some of the TikTok videos where there's a very small child, 2-3 years old, that's vaping. And then, there's adults standing around her and encouraging this behavior. So it just is a very sad situation where we're actually seeing parents not understanding that this is harmful to the child. You are introducing them to what we say drug-seeking behavior that's going to start off later in life to be more problematic.
Drug-seeking behavior, what an incredibly worrying term. The survey finding as well, Professor Schoeman, that 55% of the people who were surveyed were regular users of alcohol, but also 38% used marijuana and 4% experimented with methamphetamines.
Definitely. I think our most concerning finding was that the substances that we are treating or that we are trying to prevent the use of is not necessarily the substances that's a problem in society. So yes, cannabis is a big problem, with 38% of the children acknowledging that they are using cannabis. But then, as Adrie mentioned, often that substances that are overlooked is over-counter substances like codeine in the forms of lean or pills. And then cigarette tobacco is a big problem. And then also, like your hardcore drugs was not found to be so prevalent in use, but more the stuff that children can get their hands on easily. Hubbly bubbly, amazing big problem. And I think parents tend to find the smoking of hubbly bubbly as an innocent activity, but it's unregulated in South Africa. We do not know what is included in the shisha tobacco that the children smoke and what the level of nicotine in that tobaccos are. So, yes, I think we also need to look at the sort of not unregulated, but at the substances that's not frequently focused on.
Yeah, Adrie, can you tell us more about the issue around methamphetamine addiction? 33% of admissions in the Western Cape for that drug. Gauteng, 25% of patients admitted for addiction to TIC and other variants.
It is devastating, and we see that climbing every year. And with the methamphetamine is obviously the link to mental health conditions. So many of our clients are admitted with both, and that is quite serious because some of these mental health conditions are irreversible. So we are really sitting with a crisis in our country when it comes to methamphetamine and the treatment of that as well. So we find that there's a lack of psychiatric services, that can assist the treatment centers with these mental health conditions as well and to stabilize these clients. But we do see that as a severe problem. We have, when we look at our own statistics from the Sanca point of view, where we look at all 32 clinics, we find that methamphetamine rates very high in all our centers.
Sure. And speaking of, drug-seeking behavior, there's also a lot of people who are desperate for help to deal with exactly these addictions. You just talked about your facilities, your Sanca facilities nationally. 10,000 people treated for addiction at your facilities over the past, I think it's 80,000 over the past 8 years. Yeah, so 10,000 every year, Adrie. Is there still room for improvement there? Are you turning people away who are looking for help?
No, not at all. Actually, what is happening quite often is that people also don't look at the outpatient or community-based services. They only want to look at the inpatient services as well. But we don't turn people away. That is one of our areas that we work very closely with the Department of Social Development to make sure that people do get help. The only problem that we have is the lack of access to inpatient beds facilities. So there's a crisis in Gauteng, for instance, right now, where we have less than 600 beds now because of the life clinics that were not funded. So then people will go on waiting lists. And in the meantime, while they're on the waiting list, we encourage them to attend the outpatient or community-based services that they still provide. They still have access to treatment, but it's not ideal. I agree with you. A lot more can be done.
Yeah, Professor Schoeman, when we talk about all of these shocking statistics, as Adrie says, there's always more to be done insofar as providing help to communities.
Definitely, but I think what is often overlooked is that not all children who use substances end up being addicted or would require services. So I think what is very important is to have early prevention services within communities, within schools specifically, to empower the children to make an informed and responsible decision, as well as educators to be able to assist children when they start using or experimenting with substances, because in your childhood development, experimentation is a natural process that will happen. But then for them to get the correct guidance and to realize what detrimental effect even smoking will have on their developing brain, as Adrie referred to, is very important.
Yeah, absolutely. And obviously a lot of that awareness does start in the home as well. Professor Marelize Schoeman, let me thank you for your time this afternoon. She's a researcher and lecturer at the Department of Criminology and Social Science at Unisa. And Adrie Vermeulen, thanks very much for your time as well with the SA National Council on Alcoholism and Drug Dependence.